بسم الله والحمد لله والصلاة والسلام على سيدنا رسول الله وعلى آله وصحبه ومن والاه. I'm going to try and structure my comments to give a little bit of background about the virus. I'm sure everyone has been inundated with information, but just to make sure we're all on the same page. It's a brief overview. It's not every last detail that is out there. And then I'm going to try and explain what is happening in Canada and what steps the public authorities have taken, why they've taken those steps, and what we can expect moving forward. So as you all know, this is a virus that almost certainly started in a species of bats. We've known about the type of virus called coronavirus since the early 2000s. The first virus of this sort resulted in a problem of a similar kind of magnitude in 2002, 2003, and that was known as SARS. Canada was heavily affected during that particular problem. And even though the story went away from the media, if you read experts in infectious diseases, tropical diseases, respiratory medicine, you will find that people have been publishing about this problem and the fact that the proximity of human beings to animals, particularly in China, the trade in wild animals, for example, is essentially a ticking time bomb, and that we can expect to see another problem of a similar magnitude to arise later. So this is what's happened. In December, the first cases were recorded in a small Chinese town of only 11 million people called Wuhan in the province of Hubei. And the virus spread fairly quickly. The final tally in China was upwards of slightly more than 80,000 people who were infected. And I believe over 3,000 people, almost 4,000 people who died. Since then, the virus has spread to almost every country on the face of the earth, and the current hotspots really being in Europe would be Italy and Spain. In the Middle East, it's Iran, possibly Egypt, although it's unclear at the moment. And in North America, it's the United States that's emerging as probably the next major hotspot. What we're seeing in terms of the virus is an interaction in terms of how bad this virus is and what it does to people. What we're seeing is that there's an interaction between the virus and the environment. And so let me explain what that means, because this is important. The virus, if you assume that everyone is healthy, and if you assume that there's unlimited healthcare resources to look after people, then the observed mortality from the virus, the number of people that die after being infected with this virus, is actually very low. The percentage is very low. The problem is that a lot of people need hospital care. And so what we see is that societies and countries, healthcare systems that are able to mobilize healthcare rapidly and expand the healthcare significantly, the rate of death is manageable. So in China, even though they started very late, you can see that they were able to build entire hospitals. I think they built 10 hospitals in total in the space of a few weeks. There are these time lapse videos out there showing the construction of some of the hospitals, and literally a hospital would be up in 5 or 6 days, and then they would start treating people. Germany, which has one of the largest or highest numbers of hospital beds as well as ICU beds per million of a population, has a death rate of under 1%. It's 0.34%. And so countries that can mobilize healthcare quickly seem to be able to manage to look after people. Countries that cannot mobilize healthcare quickly for whatever reason, like Italy and Spain, for example, or Iran, um, cannot manage to keep their rate of death low. And so in Italy, for example, the rate of death is 10%. And so extremely high, really, by any standard. And that is attributed to three things. One is the overall age of the population. Italy has one of the oldest populations in Europe, a large number of people over 65 or 70. The virus, and this is the second important piece, the virus was localized, was concentrated heavily in a particular province in northern Italy called Lombardy, and it overwhelmed the system very, very quickly. Again, you'll see pictures of tents being set up on the lawns of hospitals, community centers converted for the care of people who needed hospitalization and so on. Italy was not able to do what China was able to do, and they didn't have the infrastructure that Germany had in the first place. And they had one other problem, which is thought to be the social environment. So from a social point of view, Italians are very social, much more social than Germans. And so this notion of social distancing, keeping, 2 meters apart from people, not hugging and kissing on both cheeks, 3 times, was something that was very difficult for Italians to adjust to. And so the virus spread like wildfire. And Spain, is thought to share some of these characteristics. In New York City, which is really rapidly becoming the epicenter of COVID-19 in North America, we're seeing very rapid spread. We're seeing hospitals being overwhelmed. We're seeing physicians and nurses being told that they'll be issued a single mask, and if they lose it, then don't assume that we'll be able to provide you with another mask. So the resources are being overwhelmed very quickly. And so this is what's giving rise to this. You've heard the expression flatten the curve. The idea is that what we need to be able to do is we need to be able to slow down the rate of progression or infection so that we can flatten out, spread out the number of people who are infected with the virus, hence the number of people that need healthcare over a longer period of time so that the healthcare system does not get overwhelmed, so that we end up with a mortality rate that is closer to Germany than it is to Italy. And so that's where we are. What the government tried to do is tried to institute these social distancing or really physical distancing interactions. The virus is spread by droplets, which it's not airborne. These are technical terms, I know, but essentially somebody would have to sneeze on you to give it to you. And so if we stand 2 meters apart, wash our hands all the time after touching things, or use hand sanitizer that is at least 70% alcohol based, then the chances of the virus spreading are much lower. How things proceed here in Canada is really entirely and completely dependent on what we do. There's been a number of forecasts, models of how the virus will behave based on data from around the world now. We're not the first country that is dealing with this. And every model out there shows that the behavior of this virus is almost 100% dependent on how well people adhere to social or physical distancing. And so if less than half of the population cuts down their contacts, the virus will behave much like it did in Spain, maybe in the United States, New York, maybe Italy, maybe China. If we can get that number up to 70%, who cut down their contacts significantly, then we may end up being like Germany and are able to get ahead of this. Now, what can we do individually to protect ourselves? It's really try not to get the virus, and by that you stay away from people. If other people are not taking physical distancing seriously, we should. Wash your hands after touching anything. The virus can survive on inanimate objects for a few hours. But if, God forbid, you develop symptoms, then the vast majority of people should have a fairly mild illness. It's Tylenol, fluids, stay hydrated, monitor your symptoms, and if those symptoms get worse, la qaddar Allah, then one goes to the hospital. But I just want to emphasize this point again. This is the point that I want to close with: is that this is not going away quickly. So we're talking about these measures being in place for several weeks. If we're lucky and things go well, then we're talking about 6 to 8 weeks. If we're not, if people don't take things seriously and do things by half measure, then we're looking at a much longer fight. And I said the cost is really people's lives. I know I said that was going to be my last point, but I'm going to mention one more point. I was speaking to a member of the community in New Jersey who was telling me that the community itself, the Muslim community in New Jersey, is now at a point where most everyone knows someone who's died, even in this short period of time. The National Health Service, the NHS in the UK, has issued guidance saying that they are seeing disproportionately higher numbers of Muslims. And that's possibly because, again, of our lack of respect to physical distancing and our up until now, not taking things seriously. I'm constantly being pushed to provide hope for people. And I think we have to be very careful about that. Dr. Michael Gardam, who's an infectious disease specialist at the Toronto Western, had a quote today in the Globe and Mail that said, honestly, if we can all stay home for 14 days, then this thing would go away. And that is absolutely true. If everyone stayed at home for 14 days, the virus would be snuffed out because it doesn't live in the air. The problem is that everyone has to do that, and human beings have proven remarkably selfish and resistant to the advice that people give over time. So I honestly think that we have a fairly challenging time ahead of us. We have to, and I'll leave this for Sister Rania and Dr. Ihab to talk about, we have to understand why, find meaning in being placed here at this time in these circumstances, understand what it means to be a responsible human being, a responsible Muslim in these difficult times, draw strength from whatever source that we have in order to live up to the challenge and the responsibility that is facing us. We're not the most hard done by people in the world. There are many communities and individuals and societies that are having a far harder time. And so we also need to put things in perspective. I say this not to minimize the hardship that many people are going through, both financial and social. But it is to say that we don't have a choice. And so as the old Arab verse of poetry goes, إذا لم يكن إلا الأسنة مركبا فما حيلة المضطر إلا ركوبها. That if you must take a difficult road, then you must. لا بد مما ليس منه بد. I will end here. I assume there'll be some questions. I think we'll take questions at the end of the session, but I will stop here. Jazakumullah khair.